artificial intelligence is on the verge of transforming many parts of modern society. Personal wellness is an area that is particularly exciting for me and a space where I believe many of its capabilities remain underutilized. From personalized nutrition plans to fitness coaching to personalized treatments, AI holds the promise of transforming how we approach our health. Despite the plethora of health data available to us, we have barely scratched the surface of what AI can do in this space. Hello, everyone. Welcome to the Analytics Inside podcast, where we talk about the ever evolving tech space. And I'm your host, Priya Dialani. Crucially, it paves the way for more optimized care pathways that are sustainable, accessible, and truly patient centered. However, realizing these benefits requires more than technology. It demands organizational readiness, cultural change, and strategic alignment. Let's welcome Engy Ziedan, Protege's co founder and chief scientific officer, to discuss that despite this huge potential in AI, adoption remains limited. So, technology is not the barrier. I believe transformation readiness is. Hi, Engy, how are you doing?
Hi, Priya. Yeah, I'm good. Thank you for having me. It's great to chat with you today.
Great. It's a pleasure to have you on our podcast today, NG. And of course, I mean, when we talk about AI, healthcare has been one such sector which has always been at the forefront of implementing AI and its various diverse applications across different functions. But I think, like I mentioned, I think we have barely scratched the surface and we are yet to see more developments in this space. So I think we are going to talk more about the development side and what or how the future will be like in the coming years. But before we get started, let's start the foundation or the base of our today's conversation by understanding more about Protege. So, can you help us understand more about the organization, its specialization?
Yeah, so Protege is a data layer for AI. We provide very specific data sets that enable pushing the frontier of artificial intelligence or model capability. So to keep it very simple, we are the data overhang for the model overhang. And we believe that a lot of the breakthroughs in AI over the years have been possible because of breakthroughs in accessible data that is in the right time of the right kind. And so in early 2024, we built our company to target our first vertical, which was healthcare. And there we started by asking what type of unstructured multimodal data sets would allow models, large language models, to improve their capabilities in healthcare knowledge and usefulness. Soon after, we moved to other verticals, including media, audio, robotics, and motion capture. And today, we hold information on over 100 million individuals, completely de-identified of any personal health information that is deployed to help models improve the reasoning in healthcare.
Thank you for that overview, NG. And of course, when you talk about AI, the kind of data we need, or we need those specific data sets that can enhance the efficiency of the AI models as well as the capabilities. And I think the way you have positioned your work in the industry truly sets the tone for the rest of our conversation. Now, building on that foundation, I would love to shift the conversation towards your role, specifically, NG. You have research background in applied economics and you use causal inference methods to empirically analyze large scale real world healthcare data. And your work also has been featured in the New York Times and cited by the CDC as well. So, can you tell us more about yourself? How has your journey been till date? And what exactly is your role at Protege today?
Yeah, so my background is essentially in causal inference and econometrics. And to economists, this is like a thing. They know what it is, but maybe I'll take a little bit of time to explain what it is. There is predicting the future. So, like if you run a model, you might want to know what happens next, what's the next word, what's the next action, what's the next number. And then there is also the idea that you want to understand why two concepts are related and if it's simply an association or it's actually a causal mechanism where one is leading to the other. Causal inference, statisticians or economists then deploy methods to untangle true mechanisms. To some people who are technical listening to this, they may be familiar with concepts from Bayesian statistics or instrumental variables or things like that. In economics, my research background had always focused on understanding the usefulness of a policy or a nudge or a treatment per se on a group known as the treated. When GPT came on the scene in late 2022, it was kind of a breakthrough in the ability to see very useful predictions. It was very good at predicting the next token, produced very realistic text. And then slowly and slowly, we kind of moved away from that to wanting the models to reason better, to almost think with a sense of causality. And the way that my peers in economics and I kind of think about it is that it turns out that a fundamental truth holds, which is that scaling the data, right, only reduces what's called the mean square error, but does not remove bias or does not make causal inference more possible. And so there became a need for a different look at data. You really needed data that's useful, not just large in volume. And I felt like this was a moment for me to contribute, mix the science with the commercial aspects. Our CEO, Bobby Samuels, and I had known each other from research I did in 2020. I was very lucky to be able to be part of the founding team and collaborate, basically the scientific input. Today, I run something within Protege called Data Lab. I named it that way. We wanted to call it Data Core, and I didn't like that. And the Data Lab is an interdisciplinary group of researchers. They come from rhyming but different academic backgrounds. So some have a degree in statistics or econometrics, like myself. Some have measurement theory and quality of data studies that they've done. Some are medical sociologists. Some have only studied CS and focus on reasoning, especially on robotic models. And so the Data Lab is a collection of scientists, and it sits in the middle of the organization. Our main purpose is to produce data sets that aid pushing the frontier in AI. So on a daily basis, what would happen is that we would get a request. The request is difficult and it's new. And we would start to think about ways that we could design a data set for that request that is a different department to our traditional kind of like product thinking, where there is a standardized data set that is useful to many and gets deployed in many models. The Data Lab's purpose is mainly to think about things that are outside the box and take on data challenges that we think Protege is uniquely qualified to take on.
Definitely. But Angie, can I say that I think after listening to your journey and the kind of role, I just want to say that it's legit jaw-dropping that what you're doing currently, because it's so inspiring to, understand your role. And thank you for helping us understand about, what exactly goes into the picture in terms of inference modeling. And it shows that I think this is the kind of work you're doing is so intentional and future focused, and it definitely gives our listeners a deeper understanding, not just of what you do, but why it matters in the broader ecosystem. Now, speaking of the bigger picture, I would like to take this forward and explore something that plays a pivotal role in shaping industries today. Of course, when we spoke about AI in the healthcare, AI has a potential to transform the drug delivery process, offering improved efficiency and accuracy, accelerated drug development, and the capacity for the development of more effective and personalized treatments. Healthcare is unlike any other industry when it comes to change. It is complex, highly regulated, deeply human, and of course, mission critical. So, there are several key barriers that can slow down the uptake of AI across health systems. So, of course, AI has made impressive strides in healthcare, yet its potential remains largely untapped. Can you start by sharing what you believe is holding the field back?
I definitely happy to to put on like my referee hat and be like, what's holding us back? But I think it's also worth kind of pointing out that there has been tremendous progress. You know, if you read like books like The Emperor of All Maladies, you realize we only started thinking about cures for cancer in 1960s. Today, the probability of survival from breast cancer is over 98%. So we as humans actually have this idea of human flourishing deeply engraved in us. We are constantly striving to survive. And no place have you seen gains like that in technology than life expectancy and medicine. So, you know, 18% of males would die before their first year in the 1920s. Today, average life expectancy, like in terms of mortality doesn't even hit 18% until people are in their 60s. And this goes because of progress in environmental conditions, economic growth, but also, you know, simply innovation in medicine. And so I see AI as like a catalyst that has suddenly come on the scene, allowing us to personalize medicine, detect diseases better, you know, make better expectations about prognosis, democratize access to medical knowledge, which is a huge thing. Many people around the world, America is not the world, many people around the world die of very, very preventable diseases. And this idea of disease deletion basically is what raises life expectancy. What's holding us back is maybe also what pushes us forward, in that medicine generally is a very high risk task. And so there's a lot of legal liability and guardrails around the deployment of any new technology in a medical setting. And rightly so. That being said, the lack of evaluations, true evaluations for models in the healthcare setting inhibits sometimes the take up of these models. So hospitals, institutions may be slow to encompass these technologies or even deploy them on physicians or patients because one black eye, right, stops the whole show. And so we are trying to work with models and our customers generally to build these rigorous evaluations on the effects of the technology. And evaluations are very difficult, and they're very difficult because counterfactuals are very difficult. So understanding what would be the counterfactual scenario that had occurred had you not deployed this technology requires, you know, experimental design and quasi-experimental design that is tricky and has to be done very carefully. You also see the opposite happening away from places. So if you call hospitals places or, you know, medical settings places, people are taking up AI in their healthcare as a companion very quickly. People ask models a lot of personal questions. You would be surprised the type of personal pictures people upload about their bodies, especially in areas like dermatology. They ask questions about their loved one's health or symptoms, about their own health and symptoms, and that you cannot stop. So the only way then forward is to make the models safer and better for these types of questions, because no guardrails that you will set will basically inhibit that type of interaction. People actually do love talking about their health with models. So do I. And so to solve the take-up issue in institutions at least, what I think is required is more trustworthy innovation. And more trustworthy innovation only comes if you have robust evaluations and benchmarks, which is basically one of the pillars or main purposes of our lab.
That's a really insightful perspective, NG, and thank you for unpacking that so clearly. And I think, yes, of course, AI will continue to evolve and healthcare will be at the forefront. But like we discussed, that it's a uniquely complex ecosystem, and it's not about, I mean, the barriers aren't purely technological. Like you said, we need robust evaluations, which can further drive a more trustworthy innovations, which will eventually help institutions and hospitals to effectively and peacefully, deploy these technologies without worrying about the ifs and buts of these technologies. And I think that also brings us to an important direction for our conversation moving ahead. Of course, unlocking one of the main criterias of unlocking the potential of AI depends upon the availability, quantity, quality and the completeness of data that is used to train and design the AI algorithms and models. This would require a meticulous collection of structured health data through the state mandated wide adoption of electronic medical records. So, like I discussed, you need suitable data. Of course, AI based approaches typically require a large volume of data and information for training purposes. But in many cases, the amount of data that is accessible may be limited, or the data may be of low quality or inconsistent, which can affect the accuracy and reliability of the results. So, a lot of people are also talking about the over reliance on US centric data sets in healthcare AI. Why is this such a major limitation, and how does this impact the effectiveness and inclusivity of current AI models?
Yeah, I mean, I think it's a fair question, and one that has been asked, by the way, not just about AI, but generally about like the internet and any technology that is deployed worldwide. There are more people in India that speak Bengali than the entire population of the United States. And so when you think about deploying technology, you have to think about the world itself. And interestingly, we know this from the internet and other tech, is that developing countries have a very high gradient or slope in adoption of things like the internet, mobile phones, the web generally. What they use it for is very different to what developed nations use it for, so different tasks. But in terms of penetration, I think actually developing countries may have like higher penetration than some developed countries. Also because of the age demographic. So developed countries tends to be a lot older, and developing nations are very bottom heavy in terms of age. So higher penetration of tech tools generally. We're thinking about this, and our customers are thinking about this. I don't think I've had any conversation with some of our large customers where this has not come up. How do you make the models safe and useful for everybody? It's very difficult to solve. And I can maybe go into like maybe mathematically in English why it's difficult to solve. The objective is, one, to democratize access to, say, medical knowledge to the entire world. But two, it is really, really nice if you can give a person in, I'm from Egypt, in rural Egypt, a Mayo Clinic style advice or treatment. That's also tricky because the resources that are in a rural area of Egypt, they may not be, right, the resources at Mayo. And so you would have to be encompassing of the context very carefully. Where there are resources that exist, you want to give very optimal advice, such that you are able to give world style top 10% of doctors deployed on the bottom 10% of income. It's very hard to do that. So you go to take training data from rural areas all around the world. They encompass two things in that data mixed together. And your goal, your purpose is really to split them out. Think of it as like getting the baby out of the bath by getting rid of the bath water. One, they encompass rich clinical or what's called medical ethnographic context that you really want models to see. I spend so much time reading electronic medical records from Kenya and Nigeria and India, and the stories in the medical records are different to the stories in America. So the stories in America are like, patient is refusing to go to Hopkins because she lives far away from the clinical trial. That story is not in the medical record in like rural Egypt. It's like patient went to the bone setter or the chemist, and the bone setter set her break, and now she's in pain. That is to just describe. Or you hear about things like patient thinks that God is upset with them, and so they've had this cold for a really long time and is refusing treatment. And so what you want is you want the clinical context around these people's cultures and beliefs and things like that, but you also want from it how doctors react and what resources they have, so models can give advice that is useful, right? Context useful. And so we've spent a lot of time aggregating millions and millions of records and trying to sieve through what is clinically accurate but rich in medical ethnography, right, from what is clinically inaccurate and maybe risky. It is a very hard problem to solve. I can also talk about like ways we thought about solving it, but all to say it's top of mind, I think, for everybody in the industry.
Definitely, NG. And I think what you have highlighted really exposes a broader truth that if AI is only trained on data from a single geography, especially one as specific as the US, then we are essentially building solutions with a narrow lens. And this narrowness can become a real barrier to global adoption and trust. And I think in healthcare, bias isn't just as inconvenience, it can translate into missed diagnosis or incorrect treatment pathways for millions of people. So I think I'm really glad you brought up the need for more localized and globally representative data sets. It feels like this is going to be a very important defining factor in whether AI in healthcare becomes a universal tool or just a privilege of certain regions. On that note, I would like to go a layer deeper. So, I think it's a fundamental need to have access to high quality healthcare, regardless of your caste, creed, your origin, or locality. Like we discussed, I guess, however, not everyone has access to high quality healthcare, especially those who live in rural areas where unfortunately half of the world's population resides. So, lack of healthcare facilities, insufficient infrastructure, and an absence of healthcare providers are common characteristics of rural areas. And these communities have endured decades of poor quality healthcare facilities and the weight of unequal healthcare delivery and treatment. So, I guess geographic remoteness, transportation issue, even lack of healthcare awareness, all of these can be more challenging or are obstacles for their access to healthcare. So, how do you think healthcare AI solutions should be designed to serve, these low resource settings or populations with limited digital infrastructure?
I mean, I think that this is like a question that we could think about for decades. If we look back at the internet created jobs and growth in developing countries and in remote areas of the world that no one had imagined possible. You know, I meet people who take Arabic classes on Skype. I don't know if Skype is still cool, but it used to be cool when I was young and on Skype, and the teacher is in some remote area of Egypt, never probably left their village. You meet basically people who today use LLMs. I met a taxi driver in a developing country who said he uses GPT-5 with his 5-year-old to do math. And I said, wow, how does it do on math in Arabic? Because you actually can write math in Arabic. And he said it does great so far. And I was like, wow, so you're actually able to help with the homework. That's amazing. And you take that incremental marginal gain, and then you think about that child's future, right? It means that she is better at math. She probably loves the subject, maybe goes on to specialize in it. It opens a lot of potential. So incremental technology gain is really the way forward for human flourishing. The way that we can kind of deploy models that are useful, I think for us at Protege, I'll bring it back to the data. We have to bring data that's useful. We are working on data from all over the world. Our media vertical, for example, helps provide data that's diverse in audio and video from every corner of the planet, literally. This is very useful. It's useful for models, for example, in audio that do transcription. People can now transcribe things much faster. They are able to communicate in various languages. We've seen also like audio to audio kind of models where there's no need for text transcription. So it really sits with, if you want it to be usable for everybody, then everybody has to be represented in these models, and the challenges they face have to be represented in the data. And it is a very big task. It's a very big task to say we will take on the mission of going everywhere in the world and bringing as much data that is useful and not harmful as possible. And we'll do that in an ethical way that compensates the entities providing this data and keeps everything safe. I was talking to someone who wanted to join Protege yesterday And they asked me about our choices of data sets and verticals. And I said, we definitely sometimes reject certain data, and we definitely sometimes reject certain use cases and studies to work on. But this is kind of like our moment. This is going to be done anyways. Models will be deployed worldwide. And we would like to contribute to democratizing the access of technology in a safe manner.
Definitely. And I think it really underscores a powerful shift in healthcare technology. And it's no longer about advancing capabilities, but we also need to focus on expanding the access and equity. And I think we need offline first AI and community driven deployment models because I think true transformation happens when solutions are built for the realities on the ground and not just theoretical benchmarks. I would like to go a step further into this conversation, NG, and shifting our focus as to how we can responsibly deploy AI. I think the COVID-19 pandemic revealed disturbing data about health inequity. In 2020, the National Institute for Health published a report stating that Black Americans died from COVID-19 at higher rates than white Americans, even though they make up a smaller percentage of the population. And according to the same report, these disparities were due to limited access to care, inadequacies in public policies, and a disproportionate burden of comorbidities, including cardiovascular disease, diabetes, and even lung diseases. With today's new Gen AI product, I think trust, security, and regulatory issues remain top concerns for C-suite leaders, especially those representing pharma companies or health systems or even health institutions. So, using generative AI requires AI governance, including conversations around appropriate use cases and guardrails around safety and trust. So, from your perspective, what does responsible AI in healthcare truly mean, and how far are we from achieving it?
Yeah, I mean, I think that I'm definitely not like positioned I to make very big moral judgments. I say this to my students sometimes. It's like I can't rank like moral suffering or human benefits. That's like a social decision that takes many, many stakeholders. So I tend to refrain generally from giving strong opinions. But economists have very useful tools for thinking about what's useful and what's wasteful. And some of us specialize in what's called cost benefit analyses, essentially. And it's a little different in medicine, in that in medicine, what's valuable, there's actually a nice paper about this. What's valuable is if a medical intervention causes no harm or no benefit, it's still considered valuable because it was tried. If it causes benefit and no harm, then that's, of course, amazing. In economics, if it causes no benefit, it's considered wasteful because it took away from the opportunity cost of something else that the money would have been spent on, or it wasted time, or it just put the patient through an unnecessary procedure with zero value. And so economists have like a tighter sieve for what's valuable versus wasteful medicine. And, you know, what is flat of the curve? That's kind of like the common one that is typically used, like flat of the curve medicine. We don't want to deploy AI that is on the flat of the curve, where like more spending on AI tools essentially leads to no productivity gains, either healthcare gains for individuals or efficiency gains for hospitals. It's flat at the top of the curve. We want to deploy AI where we're on the steep side of the curve. So one marginal dollar spent on AI as a technology in a hospital or by an individual leads to a large gain in health. And so thinking about where marginal gain is useful. Many people today think they know the answer. We probably don't know the answer. The marginal gain probably differs across regions and across people. There've been easy, low-hanging fruit areas that you see the marginal gain. When you talk to oncologists today, for example, they say, I only look at genomics. And essentially, genomics have benefited a lot from moving oncology decisions from simply looking at a cancer cell on a slide and guessing which immunotherapy should be paired, or where's this cancer cell originating from? Like, is it a lung disease, lung cancer that originates in the GI? Should I be looking for another tumor, or is it really lung cancer? Genomics now allows you to do these predictions at the cell level. Incredibly powerful. And what that is it's simply a prediction. It's a prediction model that has seen a lot of DNA and RNA related to millions of people and is able to create these robust relationships. There, I think AI has tremendous potential. Where it may be kind of not so useful is if technology is deployed and it's not trustworthy, it's simply creating noise. And those, I hope, would be cases where the market, using its own forces of Adam Smith's invisible hand, weeds out those use cases very quickly. But like any technology trying to find itself, in the world, there will be some useful energies. And I hope that the equilibrium we get to is that we double down on areas in healthcare where prediction is very useful. And we're seeing a lot of that at the moment. So it is also in the subtle things like pediatric cases where you upload, your child's image and symptoms, and it's helping you in an emergency. You talked a lot about developing countries. Maternal and infant mortality in developing countries varies tremendously from developed nations. I don't remember the stats off the top of my head, but I think infant mortality in the US is like 5 per 1,000 or something like that. I probably shouldn't be quoted saying it, but on the same metric in developing countries, it's 25. Yeah, so it's exactly 5.6 per 1,000 live births. I looked it up on my phone in the US, and in developing nations, it's like 25 per 1,000. And then you look at like, okay, so what do these additional infants die of? They're just born in the first few days of life. They basically die of very preventable things. And so AI there can help produce a lot of gain, because the years of life saved for an infant, you're basically saving their entire life expectancy. So you're saving like 60, 70 years worth of life, using very small adjustments and nudges and information clarity. It's a huge benefit to society. Does that help kind of answer your question, or did I give a long-winded professor answer?
No, definitely, NG. And I think that was a really powerful perspective. And of course, when we talk about deploying responsible AI in healthcare, everybody has a different perspective as to how we can approach a responsible deployment. But I think we are moving away from can we use AI to should we? And of course, if yes, how do we do it responsibly? And with, all of these technologies like cloud, automation, it will enable companies to realize the greatest value from the safety data and drive better insights and transparency so that we as patients and consumers know that the medications we may need are safe and effective. And healthcare organizations must look beyond the algorithm and focus on people, processes, and purpose. Thank you so much, Ng, for taking out the time and effort to be on our podcast today and helping us understand that adopting AI is not simply about installing software. It is about transforming clinical practice, team dynamics, and patient outcomes. With the right leadership, engagement, and ongoing support, AI can fulfill its promise of enabling smarter, safer, and more sustainable healthcare. Thank you so much for your insights, NG. It was lovely chatting with you.
Great. Thank you so much for having me.
Great. Thank you so much. So, this is for our listeners. I hope you enjoyed today's episode. You can view all our previous podcasts on Spotify and other leading platforms. Stay tuned for our upcoming podcast. Thank you so much.